welcome to this episode of the DIFABA podcast. I'm your host, Dr. Lillian Kerubo, a pediatrician and behavior enthusiast. And this week, we are continuing with a series on disabilities in honor of Disability Pride Month. We have been doing a series on disabilities. We've talked about blindness and deafness, and today we're going to talk about paralysis. If you've missed any of the past episodes, please go back on wherever you get your podcasts on, or wherever you on YouTube, so that you can see what you missed. Remember to share this episode with your friends, to like, comment, and subscribe to my channel. What is paralysis? Paralysis is defined as the loss of ability to move or feel by part or most of the body. So if one part of your body is not able to move or is not able to feel what it's supposed to, then we consider that a paralysis. So for a part of the body to move, let's say your upper limb, for it to move, you need the bones to be in sound nature. You need the muscles that are responsible for the movement to be working properly. You need the nerves to be working properly, because the nerves are what will relay the signal from your brain to your hand that you want it to move. So the nerves need to be working properly. The spinal cord needs to work properly, because the spinal cord is the connection between the brain and the nerve that will ultimately carry the signal to your hand. And you need the brain to be working properly, because the brain is what generates your intention to move. So all those are moving parts. So when a person has paralysis, it's a tough situation to exactly try and identify which part of the body has caused the paralysis. It's not just automatic that it must be the spinal cord. It could be the nerve, it could be the brain, it could be the muscles, it could be the bones. Maybe the structure of the limb itself does not allow movement. So all those are parts that need to be considered while reviewing or assessing a paralysis. So what could be the cause of a person becoming paralyzed? What can make a child especially become paralyzed? And these are many things that can cause paralysis. There's a whole list, and we might not be able to cover all the items on the list, because it's quite a huge and extensive list. As we've said, several organs and several structures are involved in movement and in the perception of sensation. So all these structures can be affected and can be defective. Birth trauma. If during the process of delivery of the child there was trauma either to the brain, or trauma to the spinal cord, or trauma to the limb itself, that can bring about paralysis. One of the commonest causes of paralysis is cerebral palsy, which may result when during birth the brain doesn't get adequate oxygenation. So that part of the brain may be responsible for generating signals to the hand to move. So the hand will not move, not because there is something wrong with the hand, but there is something wrong with the part of the brain that is responsible for sending signals to that hand to move. If during the process of delivery, maybe the child was too big, or the mother's pelvis was not sufficient for the baby to come out, and maybe there was a bit of pulling and tugging on the baby, parts of the body might be injured, like the nerves of the neck or the nerves of the hand might be injured, and so there may be a problem with moving that hand. So if the baby also, or the child, gets into an accident or is injured, perhaps in the process of play or in a car accident when they're traveling with the family, if the brain is injured or the limb is injured, this may lead to paralysis. So trauma that is not from birth, trauma that is experienced either as the child is growing or in the course of their lives. There are genetic illnesses that may result in paralysis. There are genetic illnesses that affect nerves or muscle, and this may lead to paralysis. So if you notice a pattern of paralysis in your family, it may be a genetic illness that is being passed down from generation to generation. There are nutritional deficiencies that can lead to paralysis. For example, a mother who has deficient folic acid in her pregnancy may have a child with a birth defect known as spina bifida, which is an open spine. at the lower back, and most of these children, the nerves to the lower legs are affected. So this is a child who may have a problem with walking, may have a problem with containing their urine. So this is a child who may later become paralyzed unless something is done to change the situations. There are infections that affect nerves or muscles and may lead to paralysis. The commonest one in Kenya and in Africa is polio. And polio is important to note that is a vaccine preventable disease. But if it is not, if a child gets polio despite the vaccination, or if a child who has not been vaccinated gets polio, they may become paralyzed, because polio affects the nerves and makes the muscles not be able to function, because for muscles to function, the nerves have to be in sound nature. So it's important to note that such infections can lead to disastrous consequences if not prevented or treated adequately. Some babies are born with birth defects. Some babies or people are born with a short limb, or parts of the limb are missing. So you might find a person is born without maybe a number of toes. A person may be born without the foot or the leg. So these are all causes of paralysis or inability to move. There are chemicals or drugs that can affect the nerves and the muscles and the functioning of them and lead to paralysis. One of the drugs that we use to treat cancer can cause temporary paralysis, and so it's important to be aware of some of the side effects of any medication that you may be taking, or any chemicals that you may be exposed to, especially chemicals in the agricultural and industrial sector. So it's important, if a pregnant lady is working in the industries or in the factories or is getting treatment for cancer, to consult their doctor on whether the chemicals they're being exposed to can cause paralysis in their children. There are metabolic diseases that can bring about paralysis, especially if they affect the nerves. One of the commonest one is diabetes. Diabetes is a disease that leads to inability to control your blood sugar. And when you do not have control of your blood sugar, excessive sugar is toxic to your nerves. It's toxic to your blood vessels that supply the nerves and the muscles. So eventually can lead to paralysis if it is not controlled. Diseases such as cancers that affect bones and nerves and the spinal cord or the brain can lead to paralysis. So children, unfortunately, are at risk of some of these cancers, especially if there is such a family history. So it's important that every child who has reduced function to be screened for any illness that may be causing the paralysis. So how will you know if your child has a paralysis? Most of the paralyses are obvious, because a child will not be able to walk, for example, or stand, or use a hand, or maybe they're not able to dance or do something. So most of the paralysis will be picked up by the parent quite easily. However, if it's in the early stages, you might not be able to, it might not be as obvious as we would think. So if you notice that your child has reduced movement, so let's say perhaps they used to run a distance of maybe 100 meters without any difficulty, but of late you notice that by the time they are done with 20 meters, they are tired, they can't do it anymore. Those may be the early signs that your child might be getting a paralysis. So it's important to be cognizant of your child's abilities and be aware when those abilities start to reduce or regress. If your child becomes weak, they don't have strength anymore, they're tired all the time, they can't do activities that they were previously able to do, those could be clues that your child is getting a paralysis. If your child has delayed milestones, maybe they're not able to walk by the age of 18 months, they're not able to stand by the age of 12 months, those could be clues that the child might have a paralysis. If you notice any obvious deformity in the structure of your child's legs or hands, please seek medical attention, because sometimes it may not have been picked up by a medical person, and it's up to the caregiver or the parent to say, hey, this doesn't look like what I am used to. If your child complains of feeling things, like sometimes they may say they feel pins and needles, or they may feel an insect crawling under their skin, those are signs and clues that the nerve is malfunctioning. And so it's important that this child gets checked out to make sure that everything is okay. So what if your child already has a paralysis? What if you have been told, or you have gone for some tests, and the diagnosis has been given to you that the child now has a paralysis? What then? It's a very difficult news to hear. It is not easy to process that your child is paralyzed and perhaps may not be able to do some of the things that you had planned to do, or you had thought they would be able to do. So it's understandable if the parent or the child or the caregiver becomes slightly demotivated and depressed, and requires some time to process the information. So it's okay to take time to heal, to process, to accept, and go through the stages of grief until we come to a point of acceptance. And there are people who are qualified in counseling and qualified in helping you to accept the diagnosis, to find ways to navigate the diagnosis. So first is to make sure that you visit your healthcare provider and make sure that the right diagnosis is made. Seek as many opinions as you would like. If you need a second, third, fourth, fifth opinion, and if you'd like to escalate to a more qualified person and a more experienced person, do not feel guilty, and do not make any apologies for it, because the life of your child is at stake. So it's important that you have all the information that is needed. Do your own research, get videos of people with a similar diagnosis, and see how they are living their lives and how they have adjusted to the paralysis. So make sure you get the right information. Unfortunately, in Africa, one of the other challenges is getting wrong information. We have so many brokers of health. We have so many providers of health and alternative health, and sometimes you do not know who is giving you the right information. You have doctors, at the same time you have traditional doctors, you have family who have their opinions of their experiences and what they have seen in their lives. We have spiritual leaders who also, want to throw their heart into the diagnosis and the steps that you should take to heal your child. So it's quite confusing to decipher who is giving you the right information and who is giving you information that is actually helpful to your child. So be careful of who you inform and who you get advice from, is what I would say. So once the diagnosis has been made and it has been confirmed and it has gone through the checks and it has been found to be true, depending on the advice that your healthcare giver has given you, this child may benefit from physiotherapy. So physiotherapy prevents joint deformities and prevents contractures. Often when you have a paralysis, the joint assumes a particular position and it becomes fixated in that position. So if the joint is not exercised and moved as appropriate, that joint will become permanently fixed in a particular position, which is not healthy for the child. It's also not safe for the child. So physio helps with that. Occupational therapy helps the children to get the skills that they require to get despite the paralysis. So for example, if the right hand is paralyzed, then this child needs to be trained on how to eat or write with the left hand. So that's where occupational therapy comes in. So all these are therapies that can be advised by your healthcare giver depending on how they have assessed your child, and this help the child to accommodate or to adapt to the world around them. Allow your child to enjoy as near normal a childhood as possible. If your child loved swimming, do not stop them from swimming just because one of their legs is not working. There are adaptations to allow people, even on wheelchairs, to enjoy swimming. If your child loved traveling, allow the child to continue to travel as much as is possible. If it means going with a wheelchair, if it means, I've seen families where the child is placed on a carrier bag and the parent puts the carrier bag on their shoulder and they're able to go hiking, they're able to go exploring. So the child will continue to experience as near normal a childhood as possible, because we want to also protect their mental well-being. We want to protect their emotional well-being so that they don't feel as if they cannot participate in life just because of their paralysis. They need to feel like they are included and they are wanted and they are loved and their opinion matters. And one of the ways of doing this is to include them in as many of the usual activities that the family or the society is engaging in as possible. It's important to know that once a child is paralyzed, they are at risk of injuries, they are at risk of infections, they are at risk of developing sores because of the prolonged positioning. Most of the children who have lower limb paralysis, for example, will either be lying down most of the time or sitting in their wheelchair most of the time. This means that the bum is exposed to a lot of pressure for a prolonged duration of time. So if that is not prevented, they may get sores in their bum, which are usually very difficult to treat, and they can become very dangerous for the child. So positional care is very important. Your healthcare provider will tell you that the child needs to be changed from position to position time after time. They require a specific mattress. They require specific protective gear around them. It might be a brace, it might be a certain type of diaper, it might be a certain type of wheelchair that allows them to elevate their legs. It might be that maybe every 2 or so hours they are taken off their wheelchair and put in a different position, just to prevent other injuries that may worsen the paralysis. These children also require a well-balanced diet, and they require a diet that does not allow them to become unhealthily obese. And majority of the people who are paralyzed, especially if they're not able to walk or exercise, will end up gaining weight and becoming obese because they're not moving as much as they should. So it's important that their diet is a healthy diet full of fruits and vegetables, and that is not fattening, because once a paralyzed person becomes obese, now we have another challenge that we have to deal with, which is the challenge of heart attack or the challenge of blocked vessels. So it's important that we prevent obesity even in people who are not able to move. So if this means checking what we are feeding them, if this means allowing them to do mild exercise that they are able to do with the parts of the body that are functioning, so that we avoid obesity. Obesity comes with a lot of health challenges, not just to the paralyzed person, but even to the non-paralyzed person. So one of our main focuses is preventing obesity in children. We've talked about the emotional and mental support that paralyzed children require, so that they don't feel as if they are a burden or that they are unwanted in society. And there are counselors, there are caregivers that are specialized in providing the support that is required to help not just the child but the whole family in general in dealing with this new diagnosis, and in adjusting the expectations, and in making sure that the paralyzed child still enjoys a full and thriving life despite their drawbacks. It's important as a caregiver that you anticipate some of the challenges that the paralyzed child will face. One of the challenges that they face is, as they grow older, they become heavier, and so it is not easy to carry them as easy as you used to. It's very easy to carry a 3-year-old, 4-year-old, 5-year-old child, but once they start becoming heavier, they start becoming taller, they start becoming older, it may be harder to carry them. So preparations in acquiring wheelchairs and other modes of transport should start early. They will go to puberty. Just because they're paralyzed does not mean they will not go through adolescence and puberty, and so the body changes that are seen in non-paralyzed individuals will also be seen in the paralyzed child. So preparation should be made, for example, if it's a girl child, to know that this is a child who will start menstruating, and so how will we handle this girl when they're menstruating and they're on a wheelchair? How often will we be changing the sanitary towel? Do we need a specific sanitary towel? And in certain situations, do we need to perhaps defer the menstruation? these children are also at risk of abuse. This is because they cannot, majority of them cannot defend themselves from potential abusers. So a lot of protection needs to go into these children. They should not be left alone under any circumstances. They should not be left with people whose aims and intentions we do not know. So a lot of protection needs to go into the care of the paralyzed child. They may also need assistance in their education. Perhaps if they're going to school, they need to have a specific toilet that they're able to go and relieve themselves, because perhaps getting to the regular toilet may be difficult for them. If they need to access a building, a ramp needs to be provided for them if their lower limbs are paralyzed. If they need to if the exams are being delivered, they may need extra time, perhaps if they have a difficulty with the muscles of their hands when it comes to writing. So they need extra time, or they require accommodations such as tablets that they can speak into or that they can type as opposed to writing. They may need their answers to be received in an oral manner as opposed to a written manner if their hands are unable to write. So all these accommodations are specific to the child, and they will be addressed by your healthcare provider as depending on how the child is. Remember to raise your questions or your comments through the avenues provided for you. You can comment on YouTube. You can reach out to me on my website at www.difaba.org. You can follow me on social media. On Twitter, I am at mdifabilities, and on Instagram, I am at difaba. Till next time, bye-bye.